Welcome to Abnormal Psychology, Psych 280 at Michigan State University. Today we're going to talk about eating disorders and obesity. As a whole, the eating disorders are characterized by individuals experiencing disruptions in eating behavior, and their disruptions in eating behavior then have an impact on their physical health, their psychological well-being, and even on how they function socially with others. And in our society, we have a variety of myths about eating pathology. You might have heard some of the various stereotypes like only rich girls have eating disorders, only white girls have eating disorders, you only see eating disorders in the United States, not in the rest of the world, or that people who have eating disorders are just vain and superficial, they want to get attention. And also that at any point in time, if they wanted to, they could stop, and they're just choosing to go ahead and do this, engage in this behavior. And often we think of eating pathology, and certainly the things that I've just listed as our myths would imply that eating pathology is really just sociocultural, and that sociocultural influences are what's driving the rates of eating pathology, at least in the United States. And the reality is that eating pathology is a blend of genetic, social, and psychological concerns. And even though eating pathology at the level of counting for an eating disorder is actually quite rare, subclinical levels of eating pathology are very, very high. And I'm going to show you a picture of what very severe cases of anorexia can look like. And I will warn you that the picture is a bit disturbing. And the caption here reads, "Anorexia, you'll be dead before you're thin enough. You are not alone." But as you can see, these are individuals who pretty much, by any definition, are gravely ill. They are starving themselves to the point of near death. And yet all of them in their mind still see themselves as too fat, too heavy, and refusing to take in the nourishment that they need to put on body weight. So how do we go about actually diagnosing anorexia nervosa? Well, first, we're looking for there being a restriction of energy intake that is not sufficient for their requirements. So they've restricted their energy. In essence, we're saying they've restricted calories, and they've done so to the point where they are now at significantly low body weight that's less than what we would expect for their age and gender. Now, if we think about what is normal body weight, this can be pretty difficult because if you just look around, there's a lot of variability in body weight. It's not there's not a real good standard that we can use. But the Centers for Disease Control, that's the CDC, or the World Health Organization, also referred to as WHO, they have come up with guidelines for what is too low for body weight that is usable for looking at anorexia nervosa. So if we look at BMI among adults, those who have a BMI of 18.5 are considered at the very lowest end of adult normal weight. Anything less than this is problematically low weight. Those who are under 17 are considered to be significantly below weight and have moderate to severe thinness. And those that are under a BMI of 15 are considered extremely underweight, dangerously so. Now, when we're talking about children, it's really difficult to use basic BMI measurements as the sum total to determine their body weight and whether it's below or not. And so for children, we have BMI for age, and we're looking at those who are below the 5th percentile as being underweight. And we look at this for where they are now, but of course, you also want to look at, did growth suddenly stop? So individuals who had been on a normal growth trajectory and now they're no longer growing and maintaining their weight may also be considered in the underweight category. In addition to looking at their body weight, we also look at their perceptions and emotions around gaining weight. So people with anorexia will have an intense fear that they might gain weight or they might become fat, and they may engage in behavior that constantly interferes with their ability to maintain body weight. And again, since we're talking about anorexia, the first requirement of anorexia is that they are already below body weight. So these are individuals who, despite being significantly low weight, are terrified that they are going to gain weight and are engaging in behaviors that keep them from gaining weight. So despite being seriously underweight, they might be terrified of gaining a pound, even though they're emaciated. And interestingly enough, if they lose weight, it doesn't make their anxiety go away. In fact, they may even have their anxiety increase as they're losing more weight. And very often they won't acknowledge or recognize that they're experiencing a fear of this weight gain. It will feel like it's normal and sensible to them. And the third thing we look at is, how do they see their body shape or weight? And is this incredibly distorted or not? And we look at how these distortions happen across a number of different potential ways. But basically, we're looking at their experience and the significance of their body weight or shape is distorted, and their sense of themselves and their belief in who they are and their value is influenced heavily by their body weight and shape. And they refuse to recognize the significance of their very severely low body weight. So this, again, could look a number of different ways when you're trying to assess it. Someone might feel just globally that they are fat, like they look in everything they see about them, they feel is much heavier than what it actually is. And this image here shows an image of what the woman looks like, and then an image of what her reflection actually is. So what she looks like, she's very underweight. You can see her bones sticking through. But when she looks in the mirror, she actually sees a body that's far, far heavier and has much more body fat than the body she actually has. And there's lots of evidence that this is genuine, that there's something happening that is distorting the vision that they are seeing, and what they are imagining they look like is often very, very distorted and problematic. So it could be feeling like globally their body is much heavier than it is, but it could also be a lot of concern about a certain particular part of their body being too fat. And I can think back to a teenage girl that I was working with at one point, and when she came in, she had she sat down, but she kept her feet on her tippy toes, almost like a ballet dancer. And turns out what she was doing was she was keeping her legs from spreading because she felt that she was too fat, and she felt specifically her thighs were too fat. So she would sit in a way that made it so her thighs did not spread out as she sat down. We also see that their self-esteem is often based on their body weight and shape, and the entirety of who they are and the value that they hold on themselves can be specifically related to maintaining a very, very low body weight. And despite having a very serious low body weight, these individuals will typically deny that it's a serious problem whatsoever. And in fact, we would look specifically at individuals who have lost weight and been emaciated for so long that they have entered into amenorrhea. And amenorrhea refers to no longer having their period for 3 months or more in a row. And what this implies really is that their body has begun to shut down those bodily functions that are no longer necessary for survival. The body is entering survival mode. So despite having amenorrhea, where it's a good indication that medical complications have begun, they will refuse to acknowledge that their health is at risk and that there's anything wrong with their body weight. And looking at anorexia, once we have determined that they do indeed have anorexia, we also want to specify the specific type of anorexia that they have. And we specify this by looking at what have their symptoms been like within the last 3 months. So even if they've been diagnosable with anorexia for years and years and years, it will frequently change in the way it manifests. So you look at the last 3 months to determine right now what is the type of anorexia that they have. So the restricting type is probably the type that most people are aware of. It shows that during the current episode of anorexia, the person has not regularly engaged in binge eating or purging behavior. And by purging behavior, this refers to using laxatives or diuretics, using enemas, or self-induced vomiting. Any of those could count, but ways that they're purging to get rid of those calories. So what happens here is that they are using dietary restriction and excessive exercise as a way of maintaining their low weight or losing more weight. The one that most people are surprised to find out is a form of anorexia is the binge eating purging type. So here, during the current episode, the person has regular binge eating, or they might be engaging in purging behaviors. So many people start to wonder, well, how is this not bulimia then? How is it not considered bulimia if they're binge eating and they're purging? Well, the key distinction is that they have either binging or purging or both, and they also have dietary restriction, and they are very, very low weight. So I can't emphasize how important it is that this individual has extremely low body weight, despite the fact that they are binging. And they may be using purging behaviors. They may be excessively exercising. They might be doing any of these things. But the difference between anorexia nervosa and bulimia, if they are the binge eating purging type, is their very low body weight. In many ways, the idea that people would enter into a binging purging symptom is pretty easy to understand and actually makes a lot of sense, because not eating for extended periods of time, taking in so few calories, is incredibly, incredibly difficult. So typically, anywhere from 1 to 2/3 of those with anorexia will develop binge purging behaviors within 5 years of the onset of the disease. If it's appropriate, if they have had some remission, you would indicate that as an additional specifier. So you would look at, do they meet full criteria? Have they met full criteria in the past, but they no longer have the low body weights? They've been able to get their body weight back up, but they are still struggling with criterion B or C. These are the ones that dealt with their perceptions and their anxiety about their body weight. That would be in partial remission. Then in full remission, they might meet they previously met full criteria for anorexia nervosa, but they no longer have any active symptoms, and this has been sustained at this point for a long period of time. Now, the difficulty is they don't specify how long it has to have been sustained to count as in full remission. It just says sustained period of time. If left untreated, anorexia can cause irreversible physical damage. It's catastrophic to the body. In fact, anorexia has one of the highest death rates of any of the psychological disorders. Up to 20% of those with anorexia will die as a result of medical complications of their illness. One of the things that will be important in determining whether or not they're likely to survive is how long have they been engaging in self-starvation. Those, of course, that have been engaging in self-starvation for longer have a much higher risk of death than those that have been doing this for a shorter period of time. And anorexia is typically seen as a lifelong illness. And even when people engage in treatment, relapses are very, very common. About 40% of those with anorexia will recover. About 30% eventually improve, but another 30% have significant problems with anorexia throughout their entire lives. So some of the things that we will see for those who have anorexia. One, they will often start to grow hair on their extremities, on their arms and legs, and the hair is very, very fine and very thin. And at the same time, they will often begin to lose their hair from their head. So the starvation actually will cause hair loss at the top of their head, but then they will have extra hair growing on their arms often. Starvation interferes with immune function, so they will often have a difficult time if they face illness. They're likely to become sick more often and more severely. As a general rule, they're often weaker. They become more weak over time and experience a lot of exhaustion and fatigue. They're unable to regulate their body heat appropriately, so they become hypersensitive to heat while also finding it difficult to stay warm. And ironically, they need less sleep than normal eaters. So they don't often have the same sleep patterns, and they don't sleep as long as others. They will have changes in hormone functioning, and we've talked a little in the class already about hormones and how many different parts of our body are impacted by having our hormones regulated or dysregulated. But this self-starvation and getting to this very low body weight does then lead to hormonal dysregulation, which also can contribute to amenorrhea. Individuals will experience severe dehydration, which can result in kidney failure. And they start to develop a variety of problems with their heart functioning, including having low blood pressure or low heart rate, their body temperature dropping, problems with circulation, anemia. Anemia will also be associated with having very, very severe bruising and stunted growth. In fact, many individuals who have anorexia in adolescence will find that they never do end up growing to their full height potential, even after they've stopped having symptoms of anorexia. So looking at the crude mortality rate, we see that there's about 5% per decade, and about 12 out of 100,000 will end up having a successful suicide within each year. So again, it is a very, very severe and significant disorder with very high rates of death from both suicide and medical complications. And unfortunately, it's only recently that insurance would cover treatment for anorexia because it tends to be very, very costly. And families would sell their house, go into bankruptcy to try to save their child and not be able to get any help from insurance companies. So that has now been changing, and largely one of the people that have been working on this is Kelly Klump, who is in the MSU psychology department, and she's testified before Congress telling them about the dangers of anorexia, its biological underpinnings, and the very, very high rate of death, which would hopefully spur on urgency in addressing it. So next we're going to move on to bulimia nervosa. This is a great time to take a break and come back and finish the lecture from there. So looking at this image, this is something that was drawn during art therapy with someone who had anorexia. And often I'll invite people to tell me what they think that the person is trying to represent and tell me what they see in this image. Some of the things that may jump out at you is one, the idea that the person is trapped within the toilet. feeling that their life is constrained and regulated by the toilet. They have to be close to it. They're pouring their lives away with it. Another thing that many will often point out is that the person is curled up in the fetal position, which we will often see as a sign of being very scared or very vulnerable. And also that the scene overall is very dark, and it clearly is screaming out that this individual is in quite a bit of pain. So the first thing we need to determine when looking at a diagnosis of bulimia nervosa is, what is their eating behavior like? And specifically, we're looking for recurrent binge episodes. And binge eating is defined by two primary characteristics. So one, eating an amount of food larger than what most would eat in the same period of time and under the same circumstances. So we're looking at, for a normal meal, if they're eating more than 1,000 calories, and again, not at a celebration, not at a special event, but if a normal meal is consisting of more than 1,000 calories, we typically would say this is more than most people would eat under most normal circumstances. However, if you do a souped up meal from a large fast food chain that starts with an M, you're likely to easily rack up very close to 1,000. So sometimes that number itself can be a bit deceiving. But in general, they're eating far more than most people would in the same circumstances and during the same time frame. And then the second one is this perception that they have lost control while they were engaging in this eating behavior. So individuals may be eating and they can't stop themselves, they can't control it. They maybe will hear somebody come to the door and they won't even stop to answer the door. And this changes over time. It can be really fascinating to talk to people about this history, because some say they developed a generalized pattern of uncontrolled eating and they no longer even try to control how they eat. So, and then some have stopped trying to control their eating almost at any point in time, and this would be considered a loss of control. So basically, they're no longer trying to control themselves because their experience is that they cannot do so. And some people do actually plan their binge eating, often feeling compelled to do so, especially if they became distraught or if they've been unable to engage in binging for a while. They might feel a pent-up anxiety building. And these two characteristics are very, very important when we're talking about bulimia nervosa. They are critical in defining the symptoms of a binge episode. The second thing we look at is, are they engaging in inappropriate compensatory behaviors? In essence, are they doing things to try to get rid of the extra calories so that they can prevent themselves from gaining weight? And this is, again, a wide variety of ways that people will talk about this. It could be self-induced vomiting, misusing laxatives, using diuretics and enemas, fasting, or engaging in excessive exercise. And these last two, again, I'll remind you, this can be where things start to look a little bit like anorexia. So if they're regularly fasting and they're engaging in excessive exercise, that starts to look like the things we talked about with anorexia. But the difference is with anorexia is that they are at very, very, very low body weight. Then we look at how often they're engaging in binge eating and compensatory behavior. And we want to see that this is happening at least one time a week over the last 3 months. The same criteria as anorexia on self-esteem being based on body weight or shape. And a rule out being that the behaviors do not occur only during episodes of anorexia. So remember, if the person has anorexia and they're engaging in binging and purging, the correct diagnosis would to give them anorexia with the binging purging subtype. And so some important things to help differentiate. One, if they are very, very low body weight, then they should get an anorexia nervosa diagnosis. People with bulimia typically are within normal weight range. Uh, Sometimes they may be slightly overweight. And this is because the things that they're doing to try to get rid of all the food aren't terribly successful, no matter kind of what they think, how successful they may think they are. So they've done some fascinating and a bit disgusting, interesting past studies looking at the daily food records of women with bulimia. And they found that they reported eating anywhere from 1,500 to 2,000 calories in a binge, resulting in 3,000 to 4,500 calories in a typical day. So think about it. The US caloric standards are set at around 2,000 calories. These are individuals eating potentially 2,000 calories in one setting, and they go on to have more meals during the day, maybe even have more binge episodes during the day. They've also looked at inpatient studies monitoring their intake during binges, and they found that in a typical binge, they could consume 3,000 to 4,000 calories in a binge, resulting in 7,000 to 9,000 calories in a given day. So of course, it's important to think about, well, why are these numbers so different for these two groups? Well, one, those that were having binges of 1,500 to 2,000 calories, that was an outpatient sample, whereas the second one where they were binging 3,000 to 4,000 calories, this is a hospitalized sample. So we would expect that those that are hospitalized are much more severe. 3,000 to 4,000 binges resulting in 7,000 to 9,000 calories a day most likely means they were having more than one binge a day as well. It's also possible that the outpatient sample reporting 1,500 to 2,000 calories honestly don't really know how much they're eating in a binge. Remember when we talked about people feeling like they're out of control when they're binging? For some, that will actually be dissociative, where they have disconnected between mind, body, and memory, and they're engaging in this behavior, but they are not consciously aware of what all they've done during the binge. So they may be honestly reporting what they think they ate, but they may not even be aware of all of the calories they ate. And then also maybe people are simply embarrassed. Maybe they were underreporting their binges because they could not face telling others or writing it down accurately. Whereas the inpatient study, they were actually monitoring and able to measure what they were binging. And so they were able to get a more accurate picture. There was another study. This one I will say is quite gross, but they were interested in why is it that people who are engaging in purging behaviors still tend to be average weight or overweight? And so they brought people into an eating lab where they could eat freely without any staff intervention. And then they were given their own individual plastic bucket where they are allowed to purge their contents as they would normally do. And then these poor research assistants had to take the contents and actually measure out the calories that were remaining in that bucket. So basically, they're allowed to binge. Their binges are being monitored, and the calories they take in are calculated, and then they throw up into the bucket as they normally would, and then they go and measure the calories in the bucket. What did they find? They found that on average, participants were consuming over 2,100 calories during a binge. And then when they vomited, they were throwing up about 980 calories. And the more they ate, the more they vomited. But whether or not they had a large binge or a small binge, they retained an average of almost 1,200 calories after a binge and purge episode. So think about this. People are binging and then purging, and they are thinking that they are getting rid of all the calories that they consumed. And in fact, I've even had clients talk about eating food in particular ways. So like maybe they would eat some lettuce first and then they would binge, so that they could binge and then they could purge, and they would know they got everything out once they got to the lettuce leaves or they saw the spinach. I've heard people talk about that they will start their binge with ice cream, because then when they throw up, the ice cream makes it easier to come up, and they think that that will get more of the calories out. But people have a lot of beliefs about how they're getting rid of those calories and how effective it can be, without knowing that in reality, our bodies are very, very efficient at capturing nutrients from foods. And so even though they've eaten and binged and then purged immediately after, their body is still keeping roughly 1,200 calories. Now, as always, there are some limitations for this study that we should think about. One, they were limiting their purging behavior to simply throwing up. And what we already know is that people will also use laxatives and diuretics. None of that was allowed here. That could change some of the calories that the individuals are absorbing. However, if they're using things like that, the food is still passing through their body and considerable amounts are going to be absorbed in the body. So they're still going to be retaining a significant number of calories, even if they engaged in some additional ways of purging. And some other things to think about is these are single binge episodes, but it's not uncommon for people who have bulimia to engage in multiple binge or purging episodes in a single day. And there's wide variability in this. So we don't really know how well those findings might extrapolate to any given day or week for somebody who actually has bulimia. So what are some of the effects of bulimia on the body? Well, often individuals will have very swollen, puffy cheeks. And in the moments after purging, if they've been vomiting, they will often have these little red dots all over their face. And those are broken capillaries that have broken because of the effort they were using to try to throw up. Often they will have irritated, sore, may even have tears and blood in their vomit that come from their throat and esophagus because it's actually ripping, or potentially the acids going back and forth on that tissue have created irritation. You also see problems with their heart functioning, where they may develop an irregular heartbeat, or their heart muscle may begin to weaken. They can have low blood pressure and low pulse, and even have heart failure. Individuals will often have depression, anxiety, and may have problems with dizziness. Often they will experience dehydration and electrolyte imbalances. Their stomach can develop ulcers. They may even rupture their stomach, and often will report lots of pain in their stomach. And also you'll see lots of problems with bowel movements, having constipation, diarrhea, bloating, and a lot of cramping. This picture is from the New England Journal of Medicine. And what you see here is that the woman pictured has lost almost all of the enamel from the surfaces of the anterior teeth. So badly that the yellow dentin underneath the enamel is exposed. There's a thin rim of the remaining enamel at the gum line if you look really close. And the amalgam fillings that this person has had in the past are kind of actually higher and raised above the teeth because the teeth have been eroding around them. Lastly, if you look at the top, the roof of this person's mouth, you'll see that there's a deep ulcer. And this is from the repeated stomach acids that are contained in vomit. So all of their teeth in their upper wall have been severely damaged and potentially permanently damaged as a result of the frequent purging behavior. Similar to anorexia, you see lots of changes in their hormones that can also result in irregular periods and amenorrhea. Their skin will change, where they often will develop very dry skin. You may even, if they're using their hands to vomit, start to see that they have sores on their knuckles. They will frequently develop anemia and have lots and lots of fatigue. But different from anorexia, the death rate by suicide is far, far lower. But similar to anorexia, the treatment options are also pretty difficult for individuals, and only 50% of those with bulimia nervosa will consider themselves fully recovered after 5 to 10 years after they've fulfilled treatment. A third of those who do successfully engage in treatment will actually have a relapse within 4 years. And because of this rather poor cure rate and the high relapse rate, some have begun to recommend that there be maintenance therapy or booster shots, as I often call them, after their initial treatment, where they kind of go back in for kind of check-ins on their symptoms, on their stress, on their coping, and that begins to be stretched out over time in order to make sure that they stay well after treatment. And those therapies that seem to have the best success for bulimia are typically cognitive behavioral therapy and interpersonal psychotherapy. So as far as prevalence, anorexia is less than 0.5% of the US population of women any year, whereas bulimia can be anywhere from 1 to 1.5%. So again, if we think about this typical class of 300 students, that would mean that we'll probably have at least 6 students that have diagnosable levels of anorexia or bulimia. It's far, far more common among women than men. And typically you will see 2 times where their onset peaks. So right around 14 and again, right around 18. And anorexia often will start a little bit earlier than will bulimia, but that risk period is anywhere between adolescence all the way through age 25, and you almost never see new cases that start after age 40. Without treatment, the course of both of these conditions is typically going to be chronic, and it may have flare-ups during times of stress where it becomes more severe. With bulimia, about 30% still had bulimia after treatment. I'm sorry, I will say that again. About 30% still had either bulimia, anorexia, or subclinical levels of eating pathology a full 10 years after having the treatment. About 10 to 15% will move into anorexia, but usually they will revert back to bulimia. And some continue to binge without the compensatory behaviors. And if that happens, they may qualify then for binge eating disorder, which we will be talking about. And outcomes for those with anorexia, about 22% will still meet criteria for anorexia or bulimia. And recovery typically took 5 to 6 full years. We're going to move on to discussing binge eating disorder. So again, if you need a break, this is a good time to take a break and come on back to the video. Now we're going to move on to talking about binge eating disorder. Here we're looking for recurrent episodes of binge eating, the exact same kinds of binge episodes that we talked about under bulimia. So they're eating an amount of food that's larger than most would eat in the same time period and under the same circumstances, and they experience a lack of control over their eating during this time. So they feel like they can't stop it, or they can't control it, or they're dissociative during these episodes. And binge eating episodes are associated with at least 3 of the following criteria: eating large amounts of food even though they're not physically hungry, eating until they are uncomfortable physically, eating much more rapidly than normal, eating alone because they're embarrassed by how much they're eating, and feeling depressed, guilty, or disgusted. after they've had a binge episode. Individuals also report distress over binge eating, and they are doing this at least once a week for 3 months. Their binge eating is not associated with having inappropriate compensatory behavior, and it does not occur exclusively during a bulimia or anorexia episode. So basically what we're saying is they're engaging in binge eating, but they're not throwing up or using laxatives or excessive fasting and exercising and all of those things to try to get rid of those calories. In looking at binge eating disorder, we assess the severity of the condition based on how frequently they're engaging in these behaviors. And you can see the chart there. Anything from it being mild, if they're only doing this 1 to 3 times a week, to being extreme, where they're doing it more than 14 times a week. So think about that would be at least twice a day, if not more frequently. For people who engage in binge eating, the most common trigger is that they are having some type of negative emotion, feeling sad, feeling bored, having stress between other people. But interestingly, also things like engaging in dietary restraint. So having these episodes or periods of time where they're trying not to binge can increase their anxiety and actually increase the likelihood that they would end up binging. So it creates a really tragic anxiety cycle. It's very typical for individuals to end up hoarding food or doing things to try to get rid of the containers that prove how much they ate. And this is often because they feel a lot of shame about their binge eating. And it is also common for them to engage in dieting and yet not end up losing weight. Because again, when people are binge eating, they're still retaining so many of the calories that it ends up where they sum total do not lose weight, though trying to diet the rest of the day. And this chart shows the binge eating life cycle. So typically it starts where someone is having some negative emotion. So they're having depression, anxiety, anger, perhaps even boredom. Then they end up binge eating as a way of relieving some of the stress they're experiencing. But having engaged in binge eating itself leads to more depression and now guilt about binge eating. They will then try to come up with new resolutions to get back on track and to not binge and to start dieting. But again, they experience negative emotion, and that starts the cycle going over and over again into this vicious cycle. And it's important because we want to distinguish binge eating from obesity, because they are distinct. And often when we think about people eating that much food and not engaging in compensatory behavior, then we imagine that they must all be very, very obese. But those two groups of people don't necessarily overlap. So individuals can have binge eating disorder without being obese. And very, very importantly, most people who are obese do not engage in binge eating. But if you look at the most severe cases of binge eating disorder, those who are actively trying to seek out treatment or in a medical facility, they are far likely to be overweight or obese. Some of the things we know, those with binge eating disorder typically consume more calories than others do on average, and they have greater functional impairment, lower quality of life, they experience more distress, and they tend to have more comorbid psychiatric disorders. And in looking at how common this is across the US each year, they found that women typically are 1 to 1.6% and men are about 0.8%. And to give you a gauge of this, that would be over 4 million people that have this in the US. It is more common among those who are severely obese, twice as common among women than men, but it is found across all ethnic and racial groups in the United States. Binge eating disorder tends to be more difficult to treat, and individuals tend to have more persistent symptoms throughout the life course. And despite treatment, they are more likely to engage in a relapse than those who are treated for bulimia or anorexia. And we know that cognitive behavioral therapy, antidepressants, and even some stimulant medications are helpful for helping them engage in therapy to be successfully treated and to avoid relapse. And often those individuals who have binge eating disorder will also have comorbid anxiety and depression. So this ends our discussion of the three primary types of eating pathology. But as I said in the beginning, there are very, very high rates of subclinical levels of eating disruption and very, very high rates of pathological thoughts and feelings around our body weight and size, particularly in the Western world. And so it's important for us to spend some time thinking about those cultural factors that are indeed driving these subclinical levels of eating disorder and also maybe influencing the manifestation of some eating pathology.